All right, up next, an invention based on science technology could mean hope for those with neuromuscular disorders. More on this unusual form of therapy that involves wearing a suit.
Welcome back to the program. Now, space technology, it seems, has lent itself to good use on Earth. One product is a neurosuit, a compression suit that has its roots in the Russian space technology.
Well, made of elastic material, it helps to rehabilitate people with neuromuscular disorders like cerebral palsy by gently compressing the body during intensive therapy.
And we spoke to the creator of the neurosuit, Patricia Hernandez and Sandy Millen, the mother of a child with cerebral palsy who had benefited greatly from the suit therapy.
Well, Patricia began by telling us the origins of the neurosuit.
It originated from the cosmonauts when they were going to space in the 70s, and they were in long periods of time without gravity, so they made a compression suit. This was then carried over into the 90s and then further developed by me in the early 2001, 2003 time period, and now finally has evolved into the neurosuit.
So maybe you can tell us, how does it work?
Well, I know it looks very complicated, but basically it's vests, shorts, knee pads, arm attachments, and even a hat if it's necessary. And these elastic cords or bungees all help to compress the body.
Right.
So if a patient has, say, weakness, maybe if it's an adult and they've had a stroke, or if it's a child and they have cerebral palsy and they have some weakness, it frames their body on the outside. So it supports them and gives them a much more upright posture.
I mean, looking at Zara, it suddenly looks very complicated, but she seems very happy. The suit, I suppose, is pretty comfortable and it helps her a lot.
Yes, it is. It's definitely comfortable. It makes her feel more confident when she has it on.
But what was the condition like prior? I mean, how did this suit help? I mean, what kind of improvements have you seen?
She's got a lot stronger. She seems more coordinated. And she has more confidence. When she's got it on, she feels secure. So when the suit's actually on and she does therapy then, because she is feeling confident and secure in it, she seems to work better with it. It gives her the support.
So Patricia, tell us, how does the suit actually work? I mean, is it there to help, as Sandy mentioned, provide support, or does it help sort of control the muscles? I mean, how does it actually work?
Yeah, it goes beyond what you're seeing on the outside. It is framing them, it's giving them more support, it does make her feel more secure, but the compression is actually vertically loading weight through her body, so as little as she is, it's adding extra weight for her to carry, which compresses her joints, her muscles, her ligaments, tendons, sends strong messages to the brain, helps to normalize muscle tone, and help that whole system between your brain and your body to know what it needs to do in order to move in complex tasks.
Is it supposed to be a temporary solution, or does the message get sent to the brain and then it becomes a repetition and the brain will then be able to take on the job on its own without the suit later?
Absolutely, that's the beauty of it. With any kind of neurological injury, repetition is key, and therefore when they're in the suit and they're getting the compression, it's like amplification. So the idea is that you have to repeat it less. So you still repeat the activity or the learned motor skill, what you're trying to teach, and therefore they get there faster because they're getting all that information from the suit.
So on average, how long would she wear the suit each day? Is that a certain program that she goes through?
There is. It's a program that they go through. It varies. I individualize the program for per family what they need based on their needs. So it's not a cookie cutter. Everyone's disability is very individualized. So for her, she can take the suit for anywhere from 2 to 3 hours per day. She's also very strong. Whereas someone that might have had an event happen recently, it might be an hour.
Right. But I suppose when you put on a suit like that, any person, whether it's a child or adult, will take some time to adjust. I mean, Sandy, maybe you can walk us through the first time she put it on. Did you see an improvement on the spot, or did she have to practice as well and train herself before you saw, such improvements?
I think if I recall, when she put it on, obviously it's something new, so it took a little bit of adjustment. But when I say a little time, by the end of the session even, she felt as if she was going through her normal therapy sessions quite confidently. And like I said, it gave her the support. So I think, again, going back to the fact that it gave her confidence. So she was definitely better, and we were seeing progress.
Besides the confidence level, I mean, what kind of improvement could you see? I mean, physically, I mean, was she able to move by herself?
Through time, she was definitely be able to move by herself, but she just seemed more sturdy. She seemed as if just with little support from the therapist, she was going through her exercises quite easily. And I also think that when she was going through the program, I think it sort of helped the therapist to work better with her, therefore making sure that the right muscles were being worked, that her posture was correct. And so while she has the suit on, it definitely
gives a bit more freedom as well, yeah.
Well, Patricia, you're saying earlier on that this can be, anyone can use this. It doesn't, the ages vary, right? I mean, so can the suit, I guess, be customized for each individual and tweaked and tighten or loosen in different areas? Is that how it works?
I always say from 2 to 82 or 102. Really, my oldest patient has been 92. But there's 8 different sizes, and each size is customized. On the side, there's laces and some Velcro, so each one is expandable. Right. It's about 3 clothing sizes. So there's about 5 children's sizes and 3 adult sizes, because hopefully once you're an adult, you don't keep growing.
Right. Well, it's pretty evident it's helping Zara and cerebral palsy, patients. But what about stroke sufferers? I hear that they can also benefit from the system.
Absolutely. Again, it's for any neurological type disorder. I can't say it's for every single person. There are certain people that it's just not going to be correct to use. But overall, when someone has had a stroke, they often are affected on one side. They don't feel their body the same. And the compression of the suit and the compression of the bungees helps to almost reattach, if you would, that feeling of their body back together again. And then you can learn new motor patterns, say getting the arm functioning again, or walking again, or even just sitting up.
How long on average does it take one to sort of start functioning on their own? I mean, when they can stop wearing the suit and then be back on their own?
Again, that would be just individualized based on the case. I mean, Zara would be completely different than, someone that is in their 70s that had a stroke, and it depends on the severity of the stroke.
Is this suit suitable for everyone, or are there people who would not benefit from this suit?
The compression. Yes, that would be if you have a bone issue, such as maybe the hips are dislocated or partially dislocated, or if there's some spine issues where extra weight bearing or extra vertical loading on the body wouldn't be healthy or beneficial.
Well, I understand that suit therapy is pretty common in the U.S., but we don't see it very often here in Asia. Would there be a reason why?
Well, it's actually not as common as it seems. I think the internet kind of gives that illusion that it is, but it's still not even available in all 50 states in the United States, and many families have to travel very far to get suit therapy. So we actually have brought it here to Singapore for all of Asia. So the whole goal is to then continue to reach other countries and to make it where you just go to your local hospital and receive this care and not have to travel across the whole ocean to come to the U.S.
And Sandy, perhaps just one last question. I mean, what have you seen a change in Zara? I think what has been the sort of the best outcome from having the suit assist her?
Well, the best outcome is that before the suit, she was taking, 3 independent steps. After 3 weeks, she was taking, 80? Up to 90, definitely up to 80, and a little bit more towards the end. But, yeah, that is a huge improvement in 3 weeks' time. I mean, she was making progress without the suit, but very, very slowly, and not at all consistent. And with the suit on, she seems to have just, months ahead of what she would have been without it.
And Sandy Mellon there, the mother of a child with cerebral palsy, Zara, and Patricia Hernandez as well, the person or the brain behind the neuro suit.